and get the pressure off the nerve, so that nerve, wherever it's traveling, if it's going to the heart, the lungs, the stomach, the digestion, it's going to work better without having the compression on the nerve, and therefore have a better quality of life and increasing the nerve flow or the life to that area, which is huge.
Hello, everyone. Welcome back to another episode of Coffee with the Chiro. I absolutely love that we just keep adding new faces, returning faces back to our podcast. It is so special to have Dr. Sandy and Michaela with us today. Before we get into it, I want to remind our listeners, if you have never been to the chiropractor before, if you are on the fence, do not wait, because right now, all you have to do at any of our 4 locations, call the office, tell them you heard us on the podcast. It is our 47 special. And so for 47, you're going to get your first adjustment, your consultation, x-rays, and report of findings with the doctor. 47, you cannot beat that anywhere. So heads up, if you are interested in chiropractic care, this is the special for you. Without letting everything else go, Dr. Tyler, we would love it if you would introduce Dr. Sandy and Michaela to us.
I would love to. And it's pretty cool to be on here 3 times in a row. I feel like
Love it.
that's special, so I appreciate it.
Yes.
But yeah, I'm excited who we have on today. We're going to have really kind of 2 different sides of the realm with it, because Dr. Sandy, it's been 3 years now, right, with HFC?
Just about
3 years.
Yeah.
And Dr. Sandy and her husband, Dr. Andy, moved from California 3 years ago to God's country. And they have really been an amazing asset to our team. And Sandy and Andy are both, I mean, they got a piece in every office, at some point or other, but really are holding down the Dandridge and Rogersville office, and people love y'all, and we love you guys. And so from Dr. Sandy's perspective, we're going to get 20 plus years of experience here, which is awesome.
Amazing.
And then on the other side of the room, we've got Michaela, who is a DC to B.
Yes.
Part 4 boards next weekend, right, Doc?
Yeah.
Part 4.
Got it.
If y'all don't know, to become a chiropractor, you have to take 4.5 boards with the national boards, and they're not easy and they're not fun. But once you're past that, you're smooth sailing. So she's got that next weekend. But we're going to get a really cool perspective from her. She's Life University, and just from the student mindset. And when we get a little bit into practice, sometimes you lose some of those technical terms and things like that. So she's going to help us kind of round it back a little more textbook, which is going to be awesome.
I love that so much. Michaela, I would go to Life University. Gosh, it's been like, how many years now? Oh, it's so crazy to think, like 15 years ago. And when my brother-in-law was in chiropractic there, and he would make me come into clinicals and be big. And so we loved being able to do that for him. So kudos to you. You've got this. We're all the way through your boards for you.
Before we start, Caroline, shout out your hat real quick.
Do you like this? Make
right.
America healthy again. Friends, let's go. I mean, I think this just encompasses our office and just part of what we all stand for and share and live it out. So this is one of my new favorites. I'm not going to lie. But with that being said, we have been working through podcast after podcast, the dirty dozen, the ways that you utilize how to stay healthy, right? And so now we are on numbers 9 and 10, which is what we're going to talk with Dr. Sandy and Michaela about today. And number 9 is, how would you know if you have subluxation? And number 10 is, what should you do if you have subluxation? So we will start with questions talking about topic number 9. And Dr. Sandy, we will start with you. And so first of all let's answer number 9, right? How would you know if you have subluxation?
Okay, great question. So some people may have symptoms and things, but a lot of people coming in for wellness care, they may not even know or understand that they have a subluxation in their spine. And so we do several things. When people come in, we want to talk to you, do an examination, see how things are feeling, see how things are functioning. We ask you a lot of questions. With that examination, we'll also check your posture. We want to see how things are lined up. We do what's called motion palpation, feeling and seeing what the alignment is, looking to see what the level of the spine and the vertebra are, because ultimately that's going to determine how it's functioning throughout your entire body. And so with that, we really want to check the spine and make sure it's in proper alignment, because it's not always about how you feel. You may feel wonderful, but it's about how your body's functioning. And so we're going to check that and really make sure that the spine is functioning properly by having the proper alignment.
I love that. We always say that in our office. I feel like that's such a huge motto is function over feeling. Function over
Mm-hmm.
feeling. You can
Mm-hmm.
be feeling great, but you just have no idea how much chaos is going on in your body.
Yes.
So I love that you touched on that. Dr. Tyler?
Yeah, and I think this is out of all the 12 ticks, I think this is one of the biggest ones because
Mm-hmm.
you know, we hear from our patients too, I'm becoming more body conscious. I'm understanding when my body is not functioning to the best it can. And so while we do talk about function, feelings, symptoms, signs, things like that are an alert that something's not right. So, Michaela, will you just kind of hit on, because I know this could be a really broad answer, but what are some of the main things? You've been with us for 4 months now. What
Mm-hmm.
main signs, symptoms that you're seeing that people notice that they're subluxated?
Well, just like you guys were saying, function. A lot of things can be disrupted. Like people talk about, oh, I have IBS, oh, I have headaches. People get so used to living with those things, but those are common signs and symptoms even before pain comes around that you have a subluxation.
Mm-hmm.
I totally agree. I mean, that's again just another thing we touch on in the office, or we hear a lot. First of all, when our patients walk in, well, I've had 5 to 10 headaches a month and I've lived like this for 5 years, and we're like,
Mm-hmm.
Mm-hmm.
what? No, we want to help you,
Yeah.
but people just they get used to that. And that's what we want to share is you should never be living in pain like that. Pain,
Mm-hmm.
Exactly.
that is not normal, you
Mm-hmm.
know. And
Yeah, and Michaela, what did I ask you this morning? I said I need to get checked, and why did I say I needed to get checked?
The lumbar spine because you were having some digestive issues.
Yeah, and I
Mm-hmm.
don't wouldn't normally tell this to a random person, but just being genuine on this podcast because this might relate. I've been having hemorrhoids the last 2 days, and I
yeah.
don't have hemorrhoids anymore. I used to have it when I had a lot of gut issues in the past, but it's really flared up lately.
Mm-hmm.
And I just knew if I got it checked, make sure the nerves are going functioning properly, that it could definitely get my body some relief.
Mm-hmm.
And
Mm-hmm.
sure enough, Michaela adjusted me, and I mean, didn't feel good initially, but the last couple of hours, like I have dramatically improved, and it started to go down, which is incredible. And so that's something that's just my normal is not to have that, and that I knew I was so
Mm-hmm.
excited. Michaela found 4 things from sacrum
Yeah.
to L1 that were out, which is crazy. So
Yeah.
That's huge. And that's just a testament to, again, when you come in our offices and you all as doctors are teaching our patients about the three-legged stool and to be body conscious and mindful of those things, they
Mm-hmm.
then start to get in that mindset and pick up on those things. And that's what I love seeing when we have patients come into the office that start telling you all, hey, this is going on. Hey, I know this doesn't feel right. I love hearing that because they're the ones that are picking up on those things that are not
Mm-hmm.
right with their body, you know? And so, Dr. Sandy, tell us, because obviously only a chiropractor, only a professional is helping fix and take those subluxations away. So why don't you walk us through what that process looks like when a patient comes in?
Okay, great question. So people are like, how do I know if I have a subluxation? They may feel great and have no symptoms at all, but it's all about the alignment. And so when we're checking to see, do they have rotation in their spine? Is there misalignments, or also known as subluxations, that are causing the bones to get out of place, putting pressure on the nerve. And only through chiropractic examination and palpation can we find those subluxations and therefore see what needs to be corrected and give a proper specific adjustment to correct that and get the pressure off the nerve, so that nerve, wherever it's traveling, if it's going to the heart, the lungs, the stomach, the digestion, it's going to work better without having the compression on the nerve, and therefore have a better quality of life and increasing the nerve flow or the life to that area, which is huge.
Yes. And just like I think you touched on, do you do individual adjustments? Is it, a case by case basis when patients come in our office?
It's very specific. Everybody has a different spine, and we all do have different stresses. We have a lot of different stresses, as we've talked about: chemical stress, mental, physical. There's a lot of things going on in our day and our activity and our body. So, of course, we're all going to have different misalignments. And so, one person coming in may have a specific subluxation that day, and then maybe they've done something a few weeks later. We have accidents, injuries, things like that. So we're always specifically repalpating, rechecking the spine, and giving specific adjustments according to what's needed for that person on every visit.
And Dr. Sandy, I think it hit on this. So, some of the questions we have with people that don't respond as quickly as others. Sometimes people respond in 2 visits. Sometimes it takes 2 weeks, 3 weeks, 4 weeks to really start to feel the change in your body. But somebody asked me, you're just doing the same thing over and over again. You're adjusting the same exact ones over and over again. Will you explain kind of why that might be the case early on during care? Why the same subluxations keep happening over and over again?
For sure. So when people are coming in, sometimes it may look like we're doing the same adjustments, and sometimes we are, because some of those adjustments or some of those areas where they need the adjustment, people are in different phases of degeneration. And so we have people in stage 4, stage 3, and it's been there for many, many years. So I like to give people a realistic idea that it's been there a long time. Even though we're adjusting it, we have the same, type of job, same type of stress, things that we're doing. It does take time to really correct that subluxation, for it to hold its adjustment and to keep that alignment. So I tell people, like we were talking, the 3-legged stool, you need to be consistent with your adjustment. It does take time, but it's amazing the results that they'll see by staying consistent with their adjustments, as well as doing the other things we were talking about: corrective exercises, things like that, breaking bad habits, things that we need to do that will actually help you to hold the adjustment longer and see an amazing result.
Yeah, and I explain it that same way, Doc. And what a lot of people don't understand is, chiropractic it's a holistic, it's a vitalistic approach. It's not a quick fix approach. And
Mm-mm.
like you said, some of these subluxations, their primary subluxation, right? We chart at the beginning of every new patient. You've got 6 or 7 primaries in your spine, and then a lot of it's compensation. But
Yeah.
those 6, like you said, those 6 primaries might have been there for 30 years. And so it sometimes takes weeks of hitting those same primaries over and over and over again to break the pattern, right? We talk about pattern and cycles, breaking those cycles. And Caroline, I know we crossed this question out, but if you don't mind, I think it'd be good for Michaela to hit on it.
I love that.
With school, Michaela, a lot of people always ask, why are you touching my feet so much? Why are you doing that? Those things like that. What are some of the tools that, HFC uses, maybe some other chiropractors uses to find subluxation?
Of course, in school we learn a lot of different techniques, such as Thompson, Gonstead. There's so many different chiropractic techniques that you can use, but some of the basics that we all are taught are to motion palpate and static palpate, and we use that leg check to be able to see where the pelvis is at, if there's a high side, a low side, if there's something going on with the sacrum. And we always are motioning and palpating those segments to specifically find which direction that segment has gone. If it, just like how Dr. Sandy said, the rotation, if there's any lateral to it at all, and things like that.
Mm-hmm.
Yeah, and one of my favorite things to do with people who are a little hesitant on it. I love when couples come in or families come in that at the very front, and they're like, "What are you doing with your feet?" And I said, "Watch it. Watch their feet after every adjustment. I mean, they'll be pulling right short half an inch, and after one adjustment, flip to left short half an inch. Like it's a whole body change from one adjustment. And that's why we touch everybody's feet all the time. Michaela, talking about signs and symptoms, I know we hit it. So what now?
Mhm.
Kind of on the hidden approach. What are some of the hidden things that people might be experiencing that it's not pain? It's no symptoms are there. How would they know maybe if there's like a hidden subluxation going on?
Mm.
So I guess that would kind of go back into dysfunction. We may not even realize it because we're so ingrained to believe that, oh, these things are normal. And so people just don't realize this is going on in my body and I might have a subluxation because a lot of people don't even know what subluxation is.
Mm-hmm.
So just a lot of dysfunction can be going on. Even for a long time, I had asthma and I thought it was allergies, stress induced. And so it was normal. But once I started to get my thoracic spine adjusted, I never had to use an inhaler ever again. Now, that's not the same for everybody, but for me, that was one of my chiropractic experiences that led me on that journey. So,
Yeah, and just kind of speaking to everybody listening, when should somebody go to the chiropractor? When is the right time for somebody who might have never been to go to a chiropractor?
honestly, there's never a bad time. There's always a good time. You can be adjusted as a baby, as an older adult, during pregnancy. You guys, Dr. Tyler specializes in pregnancy and infants, so come and see him for that as well. But there is never a bad time to get adjusted because even when you may feel quote unquote fine, it's always good to get checked to just maintain that wellness and health.
Yeah,
Dude,
Dr. Heskett, anytime I listen.
she's gonna crush these boards. I'm
Absolutely.
literally sitting here and I'm like, she's got it. She's got it. She's gonna be great.
She's going just fine. Dr. Heskett always said too, like I'd go into reports when I was learning how to do a lot of this coming out of school, and people would ask, "Oh, I didn't realize it was that bad," until they see their X-rays, and then they ask, "Well, when should I have started coming here?" And he said, "Yesterday." It's always the
Yes,
day before, so every day is a good day to get your spine checked.
Exactly.
For sure.
absolutely. And so, Dr. Sandy, kind of speaking on that, when should everybody come, get adjusted to kind of like go along with that? Are there lifestyle factors or habits that might make people more likely to have subluxations, and how bad or, complicated they could be?
Yeah. That's some great questions. So when we think about our lifestyle, think about some of the things that we're doing, like on our everyday life. We're on our phones, we're on our computers, we're leaning forward. We may be working hard, lifting. Think about all the daily stresses that we have, that we're around, all those different things mentally. You may be going through boards. You may be working extra hard at work. These things take a toll on our body. And so sometimes we don't even realize how much. And so it is very important to stay adjusted and come, like they said yesterday, come in and have your spine checked, and keep it checked on a regular basis because our nerve system is so important, and keeping it functioning at an optimum is how you do it, by staying adjusted, staying checked, and just taking care of your body.
Yes. And with that being said, too, we talk about people coming in for pain or things that they are feeling outwardly at this point.
Yeah.
But are there any misconceptions that people have about coming in for an adjustment? Just like the example of, well, I don't have any pain, so I don't need to come in, for an adjustment.
Yeah, I have a lot of well patients that come in. They say, I don't have any symptoms. Like, what would I need? My husband's having me come in, or my wife's having me come in because they're coming in. And then they learn, like, wow, when they see their x rays and they do the palpation, and they're like, I had no idea that that side wasn't moving, or I had no idea that I could feel this much better or function this much better. And so, like you said, people get used to it. And so, they may think they don't have anything going on until we get in there and we're helping them to see the alignment, see what the posture looks like, and then actually feeling and functioning different. And I had a guy recently in Rogersville, and he's a golfer, and he recently just won his golf tournament. He said, I thought my back was good. I thought my swing was good, but he's like, it's so much better now. I just won my tournament. So it's exciting to hear stories of how people's life is improving and things like that. And then you have somebody coming in who's in pain, and maybe they've been in pain for a while, and we're listening to those symptoms, but really tracing back to where that nerve is coming from. They may say, oh, I'm having pain, sharp pain in my calf or my foot. Well, as we draw that back to that nerve, we know that is in the lower back or the lower lumbar spine. And so we're making sure to give specific corrective adjustments to get that moving, to get the pressure off of that. And then slowly over time, they're going to have a better quality of life. And where those nerves are going, not just down the leg, but to their digestion, reproduction, prostate, all those things are going to function better at their optimum too. So that's awesome and amazing to see that. And share that with people and share their lives with them as you're helping them.
Yeah, and I think Sandy can agree to this. There are no patients more excited than golfers when they start getting adjusted. Like, golfers love when they get their score under 100, and they're like, I wish I had been getting adjusted my entire life because my golf game would be so much better.
That's hilarious.
I think we're heading on to 10 and, topic 10, and a
Yeah.
lot of it just connects with everything we're talking about.
Yes.
What should you do if you have a subluxation? That's question 10. And we're hitting on this. But Dr. Michaela, so we've already established, chiropractors are the only ones who identify subluxation. We're the only field in all healthcare that use the word subluxation on a daily basis.
Mm-hmm.
I need some of that school pool here, okay? What happens in the body when you get adjusted? Like, give me one specific kind of adjustment. Like, what's going on in that body that is correcting that subluxation and restoring function?
Of course. So you can see it behind me. The central nervous system is what drives everything in our body. And so you can kind of use this as like a visual. Imagine you're in a dark room. That's what's going on when you're subluxated. Everything's dark. When we perform that specific adjustment there, we turn the lights back on. And so that nervous system, that specific nerve, goes to the spinal cord, goes up to the brain, and it's like, now we can function. That's exactly what's going on when we're performing those adjustments.
That's a great example. I've always heard turn the light on, but
Yes.
I never thought about what's going on before the light's on. That's a great
Yes, I love that. And Dr. Sandy, can you go even further in that and just talk about the typical process and frequency of adjustments? Do most people, do they come the same time? Does everybody come once a week? Or how does that work on a patient basis?
Everybody, as they come in, we really take time, a lot of time, to sit down with people, see what they have going on, see what they've been through, traumas, injuries, surgeries, things like that. And so everybody is so individual. You may have a 30-year-old who's never had anything going on. We may have somebody who's been through multiple car accidents, maybe surgery. So everybody's so different of what they have. And that's why that examination, palpation, and just talking and x-rays are really important, because we can get a full picture of what they have going on. Until we have that, we don't really have that picture of what they're going to need. So that's established by getting all that information so that we can give them the best plan, depending on when we look at the x-rays as well and we do the palpation. We can see what phase of degeneration that their spine is in. We can see what specific misalignments they have, and then show that to them, share it with them so they can actually see it. And that's amazing when people are like, I had no idea, but I could totally see that in those x-rays. Like, wow, that's huge. And then they're like, okay, what's the game plan? And that game plan, or what we're going to be doing on their adjustments, will depend on, how swollen things are, what the alignment is, how much degeneration, trauma, things like that, so that we can get in there. Sometimes when people are really sore, we have to start on a much softer adjustment and do it more frequently, just to be more gentle, and so that they can tolerate it and feel good and work. And then slowly, as they're doing better, they're holding their adjustment. then we can decrease that. And we do re-exams in between to determine that. So we're asking them questions, plus we're feeling what's going on. And so through talking with them and having re-exams and feeling the spine, we know when to graduate down and have visits that are a little less often. And that's our goal.
Right. And so, how important is it that patients stick to the plan that you all as doctors lay out for them?
Super important. Just like you think about like brushing your teeth. I've heard people like, when I go to the chiropractor, do I always have to go to the chiropractor?
Mhm.
No, just like brushing your teeth. If you don't have to brush your teeth ever again, but you want to, right?
Yes.
That's a good word.
Because you want good health. Would you brush your teeth this week and go, I'll do that next month? No. You want to take care of your body. You want to be preventative. You want to do the best that you can for it. And so through regular adjustments that people will feel better, function better, and have a better life. And when they get in there, they do see that difference. And that is very exciting when they can have a difference in their life and they can see the difference. And so we share some of those success stories on here as well, to how people are doing and what their improvements if they want to share.
Yeah, and Dr. Sandy, I think some of the questions we get sometimes, and I know you get them too, is some people, they start 2, 3 times a week, right? We start with a higher frequency. And some of them after 3 weeks, they're 100% better. And they ask, do I need to keep on with the plan? Like I'm good to go. What's the importance of, even when you're at 100% after 3 weeks, on following through the rest of the plan?
So it's so important. It's great. We're very excited they get pain relief and that they're feeling, no pain. They're doing great. But it's so much more than just that pain level. We can have so much pressure on our nerves and never have any clue that we even have it there. And we can still have the spinal misalignment. We took that pressure off, and so they're feeling better. But it's not just about how they're feeling, it's about how the spine is doing, how it's functioning, how it's holding its adjustment. And so if they were to stop care, of course, those symptoms would come back, but it takes time to get it aligned and to get it to stay aligned and function properly and hold its adjustments. And so we know that with experience and with taking care of people. So we encourage them. I'm so glad you're feeling great, but stay on the plan because we know that this is going to bless you and that you're going to have a huge difference in the way your spine is functioning.
Yeah, absolutely. And Dr. Michaela, to kind of take a step back with the plans, right? We do pain care or corrective care at the gate, right?
That's right.
Can you give me some examples, maybe on each side? What are some of the things that people that are under corrective care or go through a corrective care plan, what are some of the health differences that they see more of, maybe than rather somebody on a pain care plan? Maybe some specific examples you've seen while you're here.
Of course. So immediately, people start to feel that pain relief, just like how any adjustment would give you pain relief. But over time, when they're consistent with those adjustments and they just keep coming, they see not only that pain relief, but they also see those dysfunctions become functional. And even I saw this when I was in school. One of my classmates, she was trying to get pregnant and she was having so much difficulty, and we switched from doing one adjustment to focusing on her low back, sacrum, where all those nerves for reproductive are, and she conceived within our senior year here, and it was just such a beautiful thing to see. So when all that dysfunction is happening over time, it's going to lessen and lessen, and you're going to be able to be more in tune with what is going on in your body, even as well.
Yeah, that's an amazing testimony, and I think we've all heard it. But Dr. Heskett's got a testimony of multiple women that come in with their husbands, and they come in with low back pain, and Dr. H
Mm-hmm.
talks about the function to the uterine lining, and then they come out after a couple weeks and they're like, well, we've actually had trouble getting pregnant lately. Is this going to help? And he's like, yeah, just stick with it, stick with the plan,
Mm-hmm.
stick with this. And their low back pain's already gone, but he said stick with the plan, because if we can get pressure off that nerve and allow that flow to come back. And I know one time he had a woman come into the office, running into the office, and was yelling, Dr. Heskett got me pregnant. Dr. Heskett got me pregnant. He's like, whoa, 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 take it, take it back.
Wait a minute. What are you
And her
talking
husband
about?
called her in, and he was like, no, 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 no.
So good. Not that way.
Not
Not
that way.
that way.
Yeah. Oh my gosh, that's so good. It's so true. You know, the longer you're in the office, the more you're around it, you just
Mm-hmm.
continue to hear these amazing stories. And that's what I love about when other people, just like Michaela sharing that story, and people get excited about chiropractic care, and especially when they've either experienced those differences within themselves or their best friends or colleagues, you know, because then it is just such a word of mouth, amazing thing to see when, you know, I have parents or other moms all the time, you never take your kids to the doctor. And I'm like, well, I do, but it's our chiropractic doctor, which is our only doctor. You know, and they're like, what do you mean? I'm like, man, we're going on. So my kids, my Carter, my middle will be 7 next week, and this will be year 4. He has not been to a medical doctor, like had to go. And it's just amazing, you know, when they see these differences and they're like, if I'm like, if they're running a fever, take them to the doctor. If they're, you know, if they are coughing or have an ear inspection, bring them to the chiropractor. Like, and these moms have no idea it can help with all of these functions,
Mm-hmm.
you know, within their babies. And so it's so amazing when those light switches go off on people who are new to chiropractic care.
Mm-hmm.
And it's just at that point, a bought and sold lifetime care patient at that point, you know? And so for those of, you know, our friends, maybe listeners out here who have never been to a chiropractor, Dr. Sandy, what should they expect on their first few sessions, especially if they're coming in with subluxations?
Okay. So when you, excuse me, when you come in, expect on the first visit to have a little bit longer visit because we're going to ask questions and have you fill out some paperwork and gather that. And we're also going to come up with a plan. So just know that on that first visit, it'll be a little bit longer. But after that, our adjustments don't take very long.
Mm-hmm.
As you come in, you'll see one of our chiropractors. They'll check your spine, get you all well adjusted, and keep you feeling better, functioning better on every visit. And so when you come in, as you'll greet somebody, I mean, like technically, when you come in, you'll greet somebody. Somebody swipes in, and then they'll go to one of our tables, be adjusted. And then honestly, the adjustments aren't, that long, but it's going to make an amazing part of their day. So it's nice that the adjustments don't take as long because people really can get back to their day. They're like, I'm going to run in before I go to work, or I'm going to run in after I go to the gym, and that type of
Yes.
thing too. So it fits into someone's lifestyle as far as having busy schedules too.
1,000%. You're not sitting in some weight room for 3+ hours, right?
Yeah.
Like wondering when your turn is going to be, which is awesome. You're in and out after that first visit, really.
Yeah.
And go ahead, Dr. Tyler.
I was just gonna say, one of my favorite comments is, especially after somebody's like never been adjusted, and you do this long, questions, exam, X-rays, and then you go to adjust them, and you adjust them in 2 minutes, and they sit up and are like, "That's it." I was like, "That's it. That's all you need today." I
Mm-hmm.
always say, I mean, because we're not doing everything else. We're just adjusting. We're not doing physical therapy. We have traction in the office, but I mean, we are a straight spinal clinic. And I always tell people this is the only thing I'm good at. So we can do it in 2 minutes because this is all we're good at. This is what we know. This is what we do every day. And so it's able to be done at a very efficient pace, and that allows us to not see people quickly but efficiently, so that we can see
Mm-hmm.
all of Morristown, all of Dandridge, all of Rockville, all of Strawberry Plains, and that's why our systems are set up like that too.
Mm-hmm.
And Michaela, so kind of wrapping it all together, everything you've learned over the last 4 years, and everything you soaked up in the last 4 months, if there were just like a couple of tips to give to somebody that may have never gotten adjusted before, or maybe they're getting adjusted right now, but they're early on in care, like what are some tips that you would give to somebody right now to get their subluxations to stay away and be corrected like that?
Of course. So for the people that haven't come, definitely come. That's my first tip. But for the people that maybe they're still experiencing some stuff, just like Dr. Sandy was saying, just give it time. It takes time to break those stress patterns. I mean, depending on what phase you're in, it's been there for 50, 60 years or longer. So you just need to give stuff time. And also make sure you're doing what the doctor's telling you to do at home, changing things like biomechanics or things at work, getting up and being active. You don't have to go out and do a bunch of crazy lifting or anything, but even just walking for an hour changes everything with your body. And just evaluating things all entire in your life that you may need to change, because we'll be able to help you as much as we can, but ultimately your health is in your own hands, and just take advantage of that and have power in that.
That's a great word.
That was a pretty solid way to end the podcast. I totally agree. Guys, you all crushed it today. The amount of knowledge that you all brought to this podcast for our listeners is truly immeasurable. I know Dr. Tyler and I are so thankful for you all taking time out of your busy schedules. I know you're studying, you have patience. I mean, we're just so blessed to have you join us today, to be on the HFC team. Our patients in all the offices are truly, truly blessed because you all are seeing them day in and day out. So I cannot thank you guys enough for being here with us today and in the office.
Thank you. Thank you for having us.
You're so welcome. All right, guys, until next time, Coffee with the Chiro, we will be wrapping up our last 2 ticks of the Dirty Dozen, and we are special. We are going to have Dr. Andy, which is Dr. Sandy's husband, on with us, as well as another one of our new doctors, Dr. Cody, will be on the podcast for the first time. So I know it is going to be another great episode. Do not forget, do us a favor. It will take you less than 60 seconds. Give us a 5-star review. Write us a little 5-word sentence. It just boosts the ratings where people can see us and hear us, and honestly just be blessed by listening to this podcast. So thank you guys so much. We love you all. Until next time. Bye, guys.
Bye-bye.
If you want to achieve optimal health and make a huge impact on lives around the world, listen up. Exposing your worth, value, and significance is the heart behind Redeem Essentials. What you may not know is how far that statement goes. When you purchase from Redeem Essentials, 10% of that money goes to our partner, Matthew 10 International, which works tirelessly to bring freedom, both spiritually and physically, to folks around the world who are desperately in need. Exposing their worth, value, and significance. Your relationship with Redeem Essentials no longer impacts you alone. Now you have the opportunity to make a massive impact on people's lives everywhere. Redeem Essentials. Your choice, their freedom.